Hello.
Now they tell us.
Yeah, but really, I wouldn't have joined if I knew.
Keep going. Yeah.
You okay, Lynn?
Mm-hmm. Why is it making that noise?
Hey, Lynn, is that the agenda?
Mm-hmm. Mm-hmm.
Thank you.
Mm-hmm.
I didn't run it off. You see a lot of my old candy.
Who else did you go see besides Kristen?
Amber,
Oh,
but I didn't recognize her name. I'm going, then she, and who's next to her? Don's wife,
oh, Amy.
Amy.
Yeah.
Sign these things.
Amy just,
Yes.
it's her first day back. She used to work a million years ago for us and now she's back.
I know she was in Muskegon last time, or doing it, or no, childcare or
She
something.
was working for the health department and then the region, I think.
Hey, Doug.
What's up? Hey, me? Good. Oh, boy. Yeah.
I didn't say a lot. He just kept saying, well, what else can we do for your business? What else? Can we do? I kept saying, nothing, nothing. He didn't believe it.
Oh, hi. How's your knee? Oh, you know.
And then I said, he says,
I'm going to write it beyond the difference.
this really got me. And then he says to me, he says,
Yeah, that's awesome.
well, he says, it's all good health.
And you? Not.
More copper.
Well, we went to
Yeah. That's what she said. He said, okay.
So this thing is like,
What?
So
Totally
it's all
clean.
part of my office shenanigans.
You know something? The reason why you didn't want to do
I
that.
tuck hearing aids.
There's a cop outside.
I want to blow up in a
And there's a
minute.
cop on the way down to there, and there's a cop at work.
You can control the volume,
And then he said,
and it's really
yeah,
nice.
that's what she said. And I stood up. He said, where you leaving? Yeah, I am leaving right now.
Oh, boy.
Hey, Matt,
Yes.
can we call the roll just so I make sure I know who's who's in attendance?
Okay,
Okay.
Thanks.
we'll officially call the Community Mental Health Board meeting of Ottawa County to order. And the first item of business is roll call. Do you want to call the names, Patricia?
Yes, thank you. Mr. Dannenberg,
Here.
Mr. Brown, Mr. Goldberg,
Here,
Mr. Holtfloor? Yes? Did I hear yes?
yes,
Okay. Ms. Larson?
Yes, I'm attending from home with a medical exemption.
Thank you. Mr. Parnin?
Here.
Ms. Van der Zog? Mr. Zylstra?
Here.
Ms. Van der Swag?
Yes,
Thank you.
yes,
Um,
I'm participating from home with a medical exemption.
Thank you. Ms. Kenyon? Mr. Serrano? And Mr. Fensky?
Yes, I'm here.
Okay, we do have a quorum.
Fantastic. This time, we're going to ask Mr. Perrin to do an invocation for us.
Sure. Let's pray. Lord, we do thank you for this day, and we thank you that you too care about all the folks here in Ottawa County, and we pray especially for those who suffer from mental illness, and I pray that you help Ottawa County CMH to be able to assist them and help folks. I pray that you help us to find each other, and we thank you for what you're going to do there. I pray for the staff here, that you protect them and give them a joy in the jobs that they have before them, help them to stay energized, keep them healthy. Pray for Matt as he leads our meeting today, that you help him, and pray too for Lynn, that you help her as she directs the agency. So we just pray that we would be of one mind today in our decision making, and we thank you for the outcome. We pray in the name of Jesus. Amen.
Amen. Thanks, Steve. Please note our mission and vision statements. And at this time, this is our first opportunity for public comment. Please state your name, give your address if you would please, and limit your comments to 3 minutes. I don't see any public comment in the boardroom. Is there anybody on?
I don't see anyone, any members from the public on the virtual.
Okay, thank you very much, Patricia. At this time, we're going to go through our consent items. And the suggested motion is to approve by consent our agenda for October the 18th, today, as well as the minutes from our September 29th, 2021 Board of Directors meetings. So we'll entertain those motions for that consent.
So moved. And support.
Is there any discussion? Seeing none, all those in favor of approval of the consent items indicate by saying aye.
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 Those opposed? That motion carries. Next is a presentation, the CIT program, and is Tim, you're going to present?
Yeah.
Thank you.
Thanks, everybody, for allowing me a chance to talk about these. My name's Tim Piers. I've been a clinician over at the jail for going on about 5 years now, until I took this position overseeing a couple of new programs for CMH. So I'm really excited about them. They're starting off really well, and I'll explain a little bit about what we're doing here. So, next slide, please. So just to add a little context for anyone who might not be familiar, mental illness and substance use disorders in the criminal justice system is a huge issue for us. 2 million individuals with serious mental illness are being booked into our jails every year. Right now, the facilities in our nation that treat the greatest number of individuals with mental illness and substance use are Rikers Island, LA County, and Cook County jails. And jail tends not to be a very effective environment to provide treatment. A lot of folks aren't able to receive it while they're there and end up back in the criminal justice in part as a result of that. Next slide, please. So this carries over to our jail. My time there, looking at some of the numbers. On any given day, we typically have around 100 inmates that would meet criteria for mental illness or a substance use disorder. So anywhere between 40 and 60% of our population. That'd be about enough to fill all the adult beds at Pine Rest at a given point. So, lots of referrals from law enforcement every year. Most of those come from jail staff. One of the things we're trying to address with the CIT program is to get road patrol to refer a lot of those folks to us now too. And in excess of 1,400 contacts with consumers we're providing services with at the jail. So, and that unfortunately that doesn't even meet the demand. There's just a lot of people needing services out there.
Break down the 500 versus the 1,400. How does that work?
Yeah, sure. So when we open an episode for an individual, we code where the referral's coming from. So I would open an episode for someone the first time I saw them, and that would go towards the 500. If I met with that person, say 3 or 4 times over the course of treatment, then that would be towards the 400. Okay. Next slide, please. One of the things I wanted to highlight in relation to these programs is the Stepping Up initiative. So that's a nationwide initiative that's been going on with the primary purpose of reducing the number of folks in jail with mental illness and substance use disorders. We've joined 27 other Michigan counties in supporting this. So our Board of Commissioners came together and signed a resolution saying they recognize this issue in Ottawa County and support us looking at ways to improve what we're doing. One of the great things to come out of that is we're offered technical assistance from Wayne State University. So they have a Center for Behavioral Health and Justice. One of their teams is going to be working with us to analyze data from the jail and other sources to see the prevalence, what's happening with these folks once they enter our systems, and come up with some recommendations on how we can improve some of these things.
So we'll turn green there at some point?
I hope so, yeah.
Okay. When do you think? I mean,
I don't know. I haven't checked the website recently.
Okay.
We might be green.
how far along are you in the Stepping Up initiative?
Yeah, so we're in the process of getting some data use agreements in place with Wayne State University. And I think once we get those approved and where they need to be, we'll be able to start collecting some data and looking at where we're at. Next slide, please. So one of the models that's really helpful in envisioning where these programs fit in and kind of what's happening in this sphere. So it is a sequential intercept model. So it starts in the community, and you can't see it, but it ends in the community. And it shows the various points along the crisis response and criminal justice systems that people experience as they go through this process. So currently we have some services at the jail that have been going on for a number of years that I took part in previously. But this Intercept 0 and 1 has been an area where we can add some things, and then Intercept 4 in particular, reentry is really important too. So I'll talk a little bit about CIT first. That's Crisis Intervention Team. And that's going to be primarily focused on Intercept 0 and 1. Next slide. So I guess a little background. CIT is something that came out of Memphis in 1988, so been around for a long time. It came out of a officer-involved shooting of an individual with mental illness. The community kind of came together and said we want to handle these situations differently. So they developed this program, and it centers around community, I guess, in the sense that it tries to bring in everybody that could be involved in crisis or in helping people that are in crisis and saying, how can we do this better? So some of the ways we're trying to do that, we're putting together a training program for law enforcement officers and dispatch. We recently, myself and my team, completed it over in Detroit, Wayne County. And it provides a lot of information on recognizing mental illness and substance use disorders, using crisis de-escalation techniques for folks who are experiencing that kind of crisis, and then learning a lot about the community resources and the experience of the families and consumers in the community that are having some of these interactions with law enforcement. So it was a really powerful training, taught us a lot, and we're looking at next year implementing our own local training, so it will be tailored to the things we have available here in Ottawa County and geared towards providing our local law enforcement with the best tools we have to offer. Another piece of this is co-response. So we have a couple of clinicians on our team that are actually going to be riding out with law enforcement partners. So they've done a little bit of that already. So they tend to be based either over at Fillmore Complex or Holland Police Headquarters right now. If a call comes through where it's clearly identified as some mental health or substance use disorder component, they're able to hop in a cruiser with their officer and head out there and get things under control together. So all of this is geared towards evaluating our crisis response system and kind of finding the gaps and ways of doing things differently. So one of the things we're really looking at is I think dispatch gets somewhere in the neighborhood of 100,000 911 calls annually, and their staff estimates about 50% of them have a mental illness or substance use component, and all of those are being responded to by law enforcement. And in talking with our law enforcement partners, right, they're pretty well trained on how to address criminality, but when it comes to mental health crisis and the needs for resources or treatment that some of these folks have, I think it's really frustrating for them because they feel like you're sending me into this thing that I don't know how to handle this, right? So really looking at the ways we can work with dispatch and law enforcement to say, well, is there a need for law enforcement in the first place? Can we do some triage over the phone or connect with a crisis clinician at some point before it gets to that point. And then our steering committee, so we're pulling together folks from all different agencies around the committee, the community, to have input. It's really important in a CIT model to bring in consumers, family members, people with lived experience to inform us in that too. And then lastly, like I mentioned, our work with Wayne State, we want to find out the areas where we really want to focus on, and we want to find out that what we're doing is effective. So that's a big piece of it for us right now. Next slide, please. So I mentioned our next program, COSAP, is comprehensive opioid and stimulant substance abuse program. And the idea behind it is basically that, one of the things that jail does offer folks who are there is a secure environment away from hopefully the substances they're using, and a lot of time to engage with treatment if we're able to offer that to them. The other piece is the reentry piece, and I'll talk a little bit about that too. Next slide. So what we're hoping to do with COSAP, if you look at these figures, it shows how much of an impact various amounts of treatment can have for folks in terms of staying both drug-free and arrest-free over time. So I think a fair proportion of the people we see at jail maybe aren't receiving treatment or aren't engaged to the point where they complete treatment successfully. So they're on the front end of things, and COSAP is really designed to identify more of these folks and move them into these later bars where they are completing treatment in the facility, and then they're connected directly to aftercare in the community when they leave. Next slide. So the different components of this program, medications for opioid use disorder, things like methadone, Suboxone, Vivitrol, if anyone's heard of those, are kind of the main medications used. Historically, we haven't been able to provide them at jail. There's a lot of regulatory stuff around that, a lot of concern that medications like that would be diverted or things of that nature. So we've been working really close with the medical staff and the deputies to design a system where we can offer these medications because they are very effective.
Excuse me, Tim, are the medical employees county employees, or is it a contracted team of?
Yes, it is a contracted agency. So
Okay.
we've been working with our corporate folks too to kind of plan how we can coordinate those services together. Group and individual therapy, we just had our first cohort. We're using Thinking for a Change. It's a cognitive behaviorally based program that targets both substance use disorder and criminogenic thinking. Went really well. Everybody involved was really happy with being a part of it. Facilitator said it went well. Jail staff said it went well. So we're really looking forward to trying to expand that so more folks at jail can be a part of that. We have recovery planning and coaching. We have a full-time recovery coach out there right now, and somebody, a coach from here that provides some services too. There's a lot of demand for this out there. Peer support is really powerful for a lot of these folks, right? I can come in and say, I've got this education and, know the treatment models, but when somebody comes down and says, yeah, I sat where you sat, I remember what it was like to need that next one and those kinds of things, that really helps engage folks and get them plugged in. Reentry services, so we're working closely with some of the transitional housing in the agency, agencies in the community, Building Men for Life, NOLA, all of them. We want to make sure we're not only connecting people to treatment when they leave, but to the resources they need. One of the things we found is that we work with folks at jail to the extent that we're able to provide some treatment, and they walk through the doors and their dealer picks them up in the parking lot or something like that, right? And it's just back to it, or they return to that house where somebody else is using, or all those kinds of things that just really don't give them a fighting chance. So, along with that, we're able to do case management up to 30 days post-release. So people get back going in the community, we can follow up for a few weeks, make sure that you get to your appointments. Do you have the things you need? Is there anything else we can do to support you? Next slide. I think that was a duplicate. Next slide. Yeah, and those are just some of my sources. So thanks for letting me share a little bit about these programs. If anyone has any questions, I'd be glad to answer.
Yeah, I got a question, Tim. I'm just wondering, as far as the crisis intervention team concept, when you're going about, measurable goals and outcomes, are you basing or going to base that on relapsing or reoffending on a case-to-case basis, or number of calls? Client one had 5 in that year, now only 2, or how would that be measured?
Sure. So I think we're looking at it from a few different angles, and I'm hopeful that Wayne State, who's worked with a number of other counties, may have some additional ideas for us. But dispatch records a lot of that information, where they're responding to, how often. The law enforcement agencies have some of that. So I think we want to focus on you know, for the people who are high utilizers of that system, are they, you know, using it less or going to more appropriate services instead of calling 911 right away? I think looking at, one of the things they've found is that after a CIT contact, people are more likely to not use 911 and things like that. They're, you know, they're connected to the local crisis line, or they're in services and they know how to reach their therapist or their peer support or things like that. So just really trying to kind of track how those things play out after we have contact is.
Do you know whether dispatches any crisis counselors directly without the deputy being with them, or is it always a twosome?
No, so what we found is it's all over the board around the country. Yeah, there's places that don't have law enforcement do the co-response. They might send out 2 clinicians or a clinician and a peer support. Some of them involve paramedics in their response in case there's a medical issue. It really varies.
Board members, any questions for Tim?
Tim, I have one.
Yeah.
Say my neighbor is having a episode. Who do I contact? And how do I contact them? I mean, I know for some things we call 211, we call 911. Is there a published number that we would call for CIT?
So I guess the answer is it depends. We're working on public email and phone number, but that would be more for like a next day referral. So somebody could call us and we could follow up. At this point, if it's something emergent where there's concern for safety or whatever the case may be, the best means probably is still just calling 911 and mentioning CIT. You know, they're aware that we're doing some of this, so you can say, yeah, this individual I know, I think there may be a mental health component. You know, if there's a CIT officer available, they may be able to send them.
I'm kind of interested in the screening process. You know, when folks are booked, how do they identify folks that have mental illness or substance abuse disorders?
Yeah.
And what's the time frame approximately? How long does it take for the identification and then a referral to you? How much time are we talking about?
So that can vary quite a bit. One of the issues we run into is the initial screening is done pretty quickly by deputies and medical staff. Well, depending on why the individual's there and what kind of state they're in, it's hard to say if you're gonna get the answers you want, right? They might say, no, I never use drugs, or you know, that kind of thing. So when they do, a lot of times something's triggered immediately, or deputies will reach out, shoot us an email right at that moment, and we'll be aware of the individual. Other times it'll come further down the line if attorney will make a referral. Hey, I'm working with this guy and I can tell there's more going on. Could you meet with them? Or family will reach out to us, or individual themselves will say, yeah, you know, come to a realization. I need some help. So.
I know if people are picked up off the streets, they don't carry all their medications with them, obviously, but you know, how long would it take for them to get back on their meds? Because I mean, they're on some serious stuff, you know.
Absolutely, yeah. Yeah, and that's a problem we run into frequently. You know, I think that's one of the reasons it's become clear how important CIT is for our community, because jails are poorly designed in terms of a psychiatric hospital, right? They're great for keeping people secure while they address the criminal issues. But it's really hard to provide the kind of treatment that people need in that setting. So, yeah, to your question, if they bring them in, and the doc can, review them and approve them, they might get them that day or the next day, but if, you know, they don't have them and there's some uncertainty about what they're prescribed, you know, it could take a number of days.
It's a huge issue for Ottawa County and the nation as a whole. I'm really glad to hear the energy and the goals that you have and putting forward here.
Yeah, thank you.
Very needed.
I'm really excited about it.
Jim?
Have you used Muskegon? Have you referred to them at all as help in setting up programs? Because they're on the map as being a provider of this service.
Yeah, so.
They're right next door.
Yeah, they sure are. Yeah, my counterpart over there, I think, has really got her hands full, so it's been difficult to connect with her quite a bit. I actually, Grand Rapids Police Department is doing some CIT stuff. We visited a training they did just a couple of weeks ago and met some of their folks, so that was a good opportunity.
We would have a lot of that.
Our CIT program is really just getting started.
Right.
So we've got lots to go, lots to learn, but it's good stuff.
It's good
Yeah.
stuff.
Question on that line, what kind of resources do we have? I mean, is it just you at this moment, or
So,
your team is?
yeah, so I coordinate this program and the other program. I have 2 clinicians under me for CIT, and then Holland Police Department and Ottawa Sheriff's Office have assigned officers directly to our teams.
Okay.
All 4 of them have been trained in the full 40-hour CIT training. And they're working already day to day doing some outreach stuff. They went out to the homeless encampments, letting people know that they're available and what we're trying to do. And
So if there's a 911 call, the preference is to look for those folks, or those are permanently tied to your program? I mean, I assume that they're doing other work during the day, or is that not the case?
our folks,
No, the sheriffs, the sheriff in City of Holland. I mean, are those permanently tied to our program, or are they
yeah.
resources
So
that you can reach out to?
they're both full-time with our program.
Okay.
So,
Okay, and then they're only answering calls related to your work.
correct.
Is there must be a fair amount of grant dollars available for this type of thing?
Yeah, I think there will be more in the future as well. So Tim's position is part grant, part millage funded.
Okay.
The 2 CIT workers are a grant through the Michigan Department of Health and Human Services. We've got the COSAP grant is a Department of Justice grant. And then we've got other grants out there as well to help pay for some substance use disorder in the jail.
Because,
So,
one
it's a
huge
mix.
cost is the training for the law enforcement staff. Frequently you're having to pay them overtime.
Yep.
Maybe they're not real excited about coming in for more training kind of thing. It's a really big issue to be able to actually train them.
Yeah,
So-
and that's come up already
Yeah.
a number of times in our discussions. I think our grant manager worked on trying to get a grant set up specifically to cover some of those
Yeah.
costs for law enforcement. So
Yeah, and that's still pending, as far as I know. So we might get that. So it brings up, we've got a variety of crisis response services, and we're going through the process right now of figuring out how they all get woven together. We have our traditional crisis team who responds to mental health crisis. A lot of their job is meeting people at the emergency departments to do assessments to see if they need to be hospitalized. They do some follow-up. We've got Tim's CIT workers as part of our crisis response. We've got Children's Mobile Crisis, which is, as you'll recall, sort of a on and off again, difficult to launch program. We've got community navigators on our access team that are doing some kind of walk-in and call-in crisis and emergency response. So we're really literally going through the process right now of figuring out how those different teams and different people work together and how we get that information out to the community and make it as user-friendly as possible. So,
Good.
yeah, it's good stuff.
Good questions, good dialogue, folks. Thank you.
Thanks, Tim.
Thanks, Tim.
Okay, I don't think we have any old business. New business, we have for service contracts, not too many of them, but nevertheless. Are you going to?
Corey, are you
Yep.
going to?
Yep.
Sorry?
So the first one is Pine Rush Cushion Home. This is a residential contract that is going in effect 10/11. And this is including a new home called the Freedom House, which is located in Grand Rapids. And we're having 2 consumers moving to this location. So I on a PDF, it got a little cut off, but I put in there that it's an average between 250 to 300,000 for those consumers a year that we'll be averaging. The next contract amendment is Hernandez Home, and this is also a residential contract. And we are including a new home that's called the Paulson Home. It's located in Gobbles, Michigan. And that's also, it's for 1 consumer, and it's going to average between 120,000 a year for this consumer. And that's going in effect in 9/16. And the next one is Hope Network Bhs. This, we are adding a new home. It's a crisis residential home, Samuel's House for Children Crisis Residential, and it's located in Grand Rapids, Michigan. And they have about $670 per diem for the people that get admitted there.
And then the last one is a new interagency agreement between CMH and the 20th Circuit Court. I see that there's a typo on Circuit Court, it's not Circuit Court. This is going to be for grant evaluation services that will be used to collect data and analysis for the comprehensive opioid stimulant and substance abuse site-based program grant that we were awarded. Just a small fraction of that grant award will be issued out to this agreement. Technically, it started back in April, but it's just to make it going here over the next month or 2.
The Samuel's House, is that for both male and female?
Yep, and it's for children 17, or I think up to 17 is.
What is their focus, sort of? I mean, is it, how into the weeds do they get?
I don't know if I'm
So, it's a short-term crisis residential, so
Okay.
it's really just
30 days or something, or?
Average stay is about 4 to 5 days.
Oh, I see.
It's like
Okay.
Robert Brown for kids.
Okay, all right. Maybe like a quick forest view, or maybe not even that much.
It's like technically a lower level care than inpatient hospitalization. It's a diversion from inpatient.
I see, okay.
They can be managed in that environment.
All right. Any questions on the service contracts? We'll,
That Hernandez Homes. Okay. Who do they treat and what are we looking at there?
They do CLS and personal care. And this is just for 1 consumer that's transferring there.
So which population are you asking?
Yeah, kind of, yeah.
I believe this is for an individual with intellectual and developmental disabilities.
Okay. And they picked this home because of their location, or, I mean, this is Gobles, that's a ways to drive if they live in Ottawa County.
Really, at this point, we're looking for beds anywhere in this entire state. So believe it or not, Gobles, Michigan is not too far from, compared to, we've got contracts for people living in Genesee County and way up north. It's not ideal, but
You can find when you grab it.
yeah, and this home offers a little bit more support for our people who might have some behavioral challenges.
Okay. And it says here it's 120,000 a year average. Is that pretty common, Lynn?
It's not uncommon. We range from $40 a day for some people up to $415 a day.
Okay, I'm gonna use an example then what I can figure. Parkview Home in Zeeland. Okay. What is the charge there about? Do you know? I mean.
Yep, so Parkview was a regular adult foster care home.
Yes,
So
yep.
their money came from someone's SSI, Social Security income, or SSDI.
Okay.
And I believe they also receive model payments, which is a little bit of dollars on top that is given to them by DHS for personal care and community living.
Okay. That's a group home, right? And there's not many of those anymore around. We're losing them left and right?
Well, we consider them all group homes, all of our residential.
The one in Hernandez Homes or Goals, that's a group home?
Yep, that's a licensed adult foster care home.
Okay, but they specialize in different things they can do?
Okay. Group homes who specialize in taking care of people who might have some real challenging behaviors tend to be the organizations who charge more per day.
Okay, which would be understandable.
It's the staffing ratio is typically a lot higher, so it might be, two consumers with one staff, or sometimes even one-on-one staffing.
Okay.
That's the charge. That's why it costs so much.
Okay. Never mind. I'll wait until you get to your report.
Sure.
Then I got more questions.
Okay.
I was gonna say, just to give you a perspective, it's $327 a day is what we're charging.
Okay.
This is a service contract, and so we will need a motion to approve the September 2021 service contracts as they were presented.
So moved. In support.
Any further discussion? Seeing none, all those in favor of approval of attachment A service contracts indicate by saying aye.
Aye.
Those opposed? That motion carries. Also under new business, you'll see that there's the annual board member self-assessment, which is in your packet. Attachment B, some of you have already filled that out. It's a fillable form. You can do it by hand, what's in your packet, or you can do it on the computer, but we would like them back so we can review all this in November at our November board meeting. And also the executive director's evaluation, which is attachment C. We would also like that back ahead of time. I think it's about, Patricia's asking, maybe was it the 18th or so, Patricia?
Today's the 18th.
Today's
Yeah, I think, whatever that, so on the Friday before, like 10 days before the board meeting. So I'll look at the date. I thought I said the 15th, but somewhere in that.
15th?
Yeah.
Oh, yeah, 15th or before, because after that, things get mucky with hunting, with bandy hunting.
That's right, exactly, yeah. So,
Tricia
the meeting
goes,
is, yes, I have to go. I have many deer to slay in the coming months, so. Yeah, if I could have them no later than the 15th, then I can get the data compiled in time for the November meeting, which is the 22nd.
Very good. Thank you. We will all do that.
Matt, this is Bonnie.
Yes, Bonnie.
I have a question on the member self-assessment. Under finance, item references the finance committee's work. Since we no longer have the finance committee, do we answer that like the board as a whole, or how do you want that item addressed?
I would probably how it's laid out, how it's presented by Keith and the different all the way from the service contracts, but also the finance part. How are we doing with spending of the money? Are we in the green? Are we in the yellow, red? Those type of things.
But the entire board would be the committee.
Yes,
basically. you know.
yep. The board,
Okay,
board as a whole would be evaluating how that whole process
Mhm.
is going and how's our millage and, in compared to, bucket lists of other, maybe, other folks in the region.
We'll need to update.
okay,
So that's a good catch, Bonnie.
okay. But for
Yeah,
now, just
yeah,
kind
good.
of answer. with
Good
the
eyeball.
board as a whole.
Mhm.
Thank you.
All right, thank you.
With that being said, we're to Lynn's executive director's report.
Okay. And just for those of you who are wondering why Keith isn't here, this is, our fiscal year starts October 1st, so there's not a whole lot to report in this two weeks. So we typically don't do a
It's all
finance
green
report.
right now.
That's right. We're doing really well right now. But he'll be back next month, so you can pick his brain then. So some updates from the state. I kind of, when I was writing my report, a lot of this was the same thing I said last month. But so we still continue to struggle with direct care workers and staff across the board, just filling positions. If you have the answer to that, let me know, because you know more than anyone else in the state as far as what's going on with the staffing crisis and what we can do about it. We are working on some kind of cool things. One of the areas that I've been working on with some of our bigger providers in the region is standing up a certificate program for a direct care worker, thinking along the lines of a career path for them. So we've been talking with GRCC right across the parking lot and had another meeting today. It looks like we're moving forward. It's not a done deal yet that GRCC will offer that certificate program, but it's moving along as far as their process of putting an outline together and then presenting that to the powers that be over there to decide whether a certificate program would be a good idea. To me, it's sort of some long-term thinking about, along the lines of maybe a CNA, sort of validating that this is a legitimate job and a legitimate career. I think it would be also helpful if there was a wage differential for those people who had their certificate.
Mm-hmm.
So work continues there. I think it's, we're not the only ones in this boat. The other people on the phone were Pine Rest and some of the local hospitals. So we're really actually looking at a certificate program that might encompass all of those different positions. And then there would be some portability as far as people working in group homes or people working in psych hospitals, that type of thing. The other big thing that is being talked about at the state is those bills that are out there that would pretty much reorganize our public mental health system. Senator Shirkey's sort of become more aggressive in his advocacy for other people to recognize how his bills would solve the problems of the mental health system. They've put out a series of informational, like one-page sort of, this is why this is a good idea. That I think one of the papers says, this is what they're saying, this is what they mean. We is the CMH system. So they're kind of counter challenging some of the things that the opponents of these bills have been saying. Needless to say, we're trying to stay on top of it. I had a conversation with our lobbyist last week, and we'll keep plugging away. Really, I think it's a matter of the CMH system really does need to come up with their own plan. We can't just sit back and say, no, Shirkey's plan is bad or Mary Whiteford's plan is bad. we really do have to be, I believe, more intentional in saying, we recognize where some of the issues are, and this is what we suggest happens in order to make that better. So I've given that information and that feedback to Bob Sheehan at the Board Association, and we'll see where it goes. Hopefully we'll have something a little bit more outlined that we could then present to our local legislators and say, listen, there is another plan, consider this one.
When will this come up for a vote?
When will it?
Yeah,
Well, at first it seemed like it was going to be tied to the budget, but it's really, it's not tied to the budget anymore. So, Shirky's
sometime
got,
between now and next October 1 or?
sometime between now and when Shirky's done.
Right, first of the year.
Oh, the first of the year.
Yeah.
So that's really quick.
No, next year.
Oh, next, okay.
2022,
Yeah.
Okay.
or sorry, 2023.
He's got another year yet.
Mhm.
Yeah.
Okay.
Yeah, I wish it actually would have been related to the budget, because then it would have been done for this year, but there are budget issues related to it, so that would also have to be addressed. So,
Have you ever reached out to the county's lobbyist,
that's who I talked to.
Bob DeVries?
Yeah,
Oh, you did not, but Sheehan also.
correct.
Okay, so you had dialogue with Bob.
Yeah, a
DeVries.
couple of
Okay.
them. And John Shea's pretty good about
Okay.
keeping him informed and us connected. So Bob's also in favor of, don't just say no, have something to offer instead.
Put
which
something
makes
down
sense.
on the table.
Yep. Not a whole lot of information about Mary Whiteford's proposals for bills. She has been going around the state having some listening sessions. And then there's also a new group, Representative Braybeck out of Washtenaw is hosting some listening tours, and I'm scheduled to sit in on that. I think that's next week. So I'll let you know how that goes. If anyone's interested in participating in that that listening session, I can give you the information for the call. Moving on, so from the LRE, I've mentioned a couple times that we are waiting on the department to get back to us on the settlement for the month-to-month contract, and it's taken forever. They finally did respond back to Mary Dumas, and it wasn't what we expected. They actually added, and this is coming from the Assistant Attorney General and MDHHS, they added quite a few stipulations to the agreement, including data collection and functions, utilization management functions that no other PIHP has to do. So, yeah, so, they've pretty much left the LRE alone for the last 2 years after they said they were going to end their contract. And again, lo and behold, the Medicaid rates, I know, the Medicaid rates have been adjusted so that we're no longer struggling financially. And pretty much they've left us alone with no corrective action plan. And now all of a sudden, 2.5 years later, in order to settle this, they're telling us we have to do all this additional work. So it came as a surprise.
Is it retroactive, or is it,
Moving forward.
are they wanting it from the data collection material from?
From when the agreement gets signed, and 90 days after that, they want it to start.
No, but
So now all
not
of a
past
sudden-
stuff.
No. Yeah, it's interesting.
Yeah, well, we get billed. I'm sure the answer is yes, to see what those objectives are that they're, what they're going to be looking for that they don't get now.
Yeah, they've spelled it out, but what they'll do with it is a entirely different question. So, but if we did all that, they would take us off the month-to-month contract and give us a year-long contract like everyone else. So Mary Dumas and the LRE's attorney they're in the middle of discussing that. I know that they've spoken about it at the board meeting, and they'll continue to do that. it did not really talk at all about the past liabilities.
Hmm.
And if it even had some language in there that suggested that they weren't going to do anything about past liabilities. So there's, as you know, the LRE is in a lawsuit with the department about this, and Muskegon CMH is also in a lawsuit related to this. They actually had to sue the LRE in order to get to the department. But nonetheless, there's lawyers involved, and we'll see where that goes. I'll keep you updated on that. From CMH, we continue to be incredibly busy. I think I shared recently that we normally have about 30 people scheduled for intake appointments on at any given time, sometimes even less, 20 to 30. I think last week we were at 69. So we're seeing a pretty significant increase in requests for services. A lot of them are kids, but not all. We're seeing a lot of hospitalizations.
Adults and kids, or for hospitalizations?
They're not all kids, no, adults.
Adults and kids.
So we're doing our best to stay on top of those numbers. With that, along with the not being able to fill positions because of the staffing crisis, it's getting difficult to meet our contractual requirements of timeliness. But so far, we've still been meeting those. So, you know, it's not surprising with COVID and everything that's going on. We've been predicting that we were going to see an increase in requests for services just because of everything that's going on in our world. So we're definitely seeing that as far as people asking for help. And it's good that they're reaching out. It would be nice to be able to say we had staff adequate enough to manage all those issues. And related to staffing issues, we're bringing some positions this week to finance that will then go to the Board of Commissioners to kind of round out some leadership positions that we need filled as far as holes. And then we will also likely be going back to Human Resources with some additional requests. If Keith was here, he would tell you that our final Medicaid rate numbers ended up being very favorable to us. So it looks like we will have some additional money to spend next year, and I would like to do that by providing services. So we will likely have some additional positions that we'll be requesting in the next coming month or so. So I think that's all I have, unless people have questions.
Lynn, you talk about the staffing and stuff, and I know we're trying to get you some more money and more staffing is good. Right now, if all of a sudden I call in the mental health saying I'm seeing little green Martians, that's all I see out there. How long would it take for me to see somebody from mental health? Or would you suggest me to go right to the Holland Hospital for the psych ward?
Well, it depends on the level of your issue. So
okay, then how long would it take me to talk to someone then?
So you could talk to someone immediately. If you called us right now, the phones are answered by our staff, and if they're on the phone and we don't have any lines open, it'll kick over to our contract support. And then we would assess your issue. And if you told me that, well, I've seen green men my entire life, this isn't really a problem, but I would like services, we have to contractually get you in. We have certain timelines for when we see people for intake and then when we provide the first service.
Okay. So if someone called, they would have someone to talk to right away, more or less that day or within 4 hours?
Yep.
Probably? Okay.
Yep.
Okay.
And we also have a crisis line that's manned 24 hours. So if it wasn't calling us directly at our number here, you could also be connected to our crisis line.
Okay. 211 would send us here or to our crisis line?
They would probably try to weed out as well, but they would send Joe to either one.
Okay. Okay. Just just asking.
Mhm.
You were talking about, we're not over the hump yet of filling positions, even on group homes and stuff like that.
Mhm.
Okay, and this kind of caught me by surprise. There's a restaurant now in Grand Rapids. They are paying benefits.
Mhm.
I think they gotta work there so long,
Mhm.
and then they'll start getting benefits. Do all of our workers at the group homes get benefits, or
Most do not.
do they not work enough hours, or do they just not get them?
So, most group home staff are part-time.
Okay,
And some of that is because, a lot of these agencies are very part-time or very small and might not be able to afford a benefits package if they had full-time employees. Some of our contractual residential providers do provide benefits at some level.
okay,
Not all of them do, though.
no. Ottawa County doesn't have any group homes for quote. That's a individual that owns that group home. Am I correct on that?
We don't own any homes.
No.
There are some CMHs that own the homes,
Okay,
but Ottawa County does not own any residential homes.
okay,
So it's either an agency that we contract and they might have
Yeah.
multiple homes that
Yeah.
either they own or they
Yeah.
lease.
okay,
And then we've also got individual families who offer residential beds out of their home and they own their own home. And that's usually just one home.
okay. Thank you, Lynn.
Mhm.
Any other questions for Lynn? Okay. Next item is general information, comments, and meetings attended. I think the state's conference is coming up, Traverse City.
Next Monday and Tuesday. And it's not too late if someone wanted to go to that.
Lynn, I have thought of it, I don't know how many times. I thought, yeah, there we go, but no.
I know people are busy.
It's, commission board meeting too.
Next Tuesday.
Yeah.
Yeah, next
Oh,
Tuesday.
okay.
Missed that, you know?
Yeah.
So, but I have thought of it.
Okay, this is our second opportunity for public comment. I don't see any new public coming in here. Anybody on Zoom?
I don't see
Tricia?
anyone. I see no one. Thank you.
All right, well, thank you. If there's no other agenda items, we'll stand adjourned. Did you find any information out on our little bit?